KangarooMotherCare, or KMC, is a simple, inexpensive, effective and safe method of caring for preterm and low birth weight babies. The purpose of this video is to explain and illustrate the practice of KMC. We also give a few pointers on setting up a KMC service and a summary of the evidence on the benefits of KMC. In the late 1970s, KMC, or skin-to-skin care, was developed in Bogota, Colombia, in response to shortages of healthcare staff and equipment, high infection and mortality rates among preterm and low birth weight babies due to overcrowding and abandonment of such babies in neonatal care units. KMC is a complex intervention but consists of certain key components which are illustrated in this diagram. The kangaroo position refers to placing the baby in an upright position against the mother's chest in skin-to-skin contact. A second component is kangaroo nutrition. Then there is kangaroo discharge and follow-up. To practice KMC successfully, the mother needs a supportive environment. This is made possible by contributions from healthcare workers, the mother's family, and people in the community in which she lives. Much research has been done on the practice, physiological effects, psychosocial aspects, safety and benefits of KMC. Pooling the results of the randomized trials is limited by differences in duration of KMC and timing of the outcome assessments. Allocation concealment is unclear in most studies. However, there is considerable consistency with regard to improved outcomes. In individual studies, there were significant improvements in weight gain, head growth, temperature and blood sugar maintenance, infections, breastfeeding, attachment, mother satisfaction and sense of competence and involvement, severe illness at 6 months follow-up, and mortality. No adverse effects were identified. Let us now look more closely at how to apply the various components of KMC. Positioning the baby correctly in close skin-to-skin contact is the first and foremost step. Preterm babies are fragile and are very easily stressed if not handled with care. Transfer the baby to the mother's chest with the upper and lower limbs flexed towards the midline, contained within the hands of the caregiver to maintain this flexed position. Place the baby skin-to-skin between the mother's breasts in an upright position. Keep the arms and legs flexed and the hips slightly abducted or slightly bent outward. Turn the baby's head to the side in a slightly extended position. This is sometimes called the sniffing position. It ensures that the baby's airway is not blocked and allows eye-to-eye contact with the mother. Avoid forward flexion or overextension of the neck. Secure the baby with a binder or wrap. Tie the wrap firmly enough so that the baby will not slide out. Position the top edge of the wrap at the baby's ear. This keeps the head secure and prevents it from flopping forward or backward. Place the tight part of the cloth across the baby's chest and upper back. Ensure that the baby's tummy is not constricted so as to allow enough room for abdominal breathing. These are a few of the many different types of pouches and wraps that are used across the world to hold babies in the skin-to-skin position. The second KMC component is nutrition. Breast milk is the best food for babies, especially for preterm babies. Mother's milk is biologically unique. It adjusts itself to the baby's gestational age and requirements. If the baby is fed in a controlled manner, hypoglycemia and over or underfeeding are prevented. Small babies need frequent feeds every 2 to 3 hours. Initially, many preterm babies do not suckle well or at all at the breast. They should be fed expressed breast milk. There are various methods to feed expressed milk. Feeding through nasal or oral tubes should be done in the KMC position. As soon as a baby is able to start with oral feeds, use cups, spoons, or syringes until the baby is able to feed from the breast successfully. The third key feature of KMC is the earlier discharge of the baby from the healthcare facility. This includes the continuation of KMC at home and a strict follow-up schedule. Regular follow-up and review of babies receiving KangarooMotherCare are very important. Monitor weight, length, and head circumference. If a baby is not thriving, evaluate feeding practices and adherence to KMC. Do a general examination of the baby and continue education on danger signs that need prompt care. Always schedule or confirm the next follow-up visit. Once the baby reaches 2,500 grams or 40 weeks post-menstrual age, most mothers will be referred to their nearest well baby clinic, and they may need special follow-up periodically. This is also the time when most babies are ready to discontinue KMC. Health workers support the mother to become the primary caregiver of her baby and be confident to continue practicing KMC safely. When the mother and baby go home, they need the support from other household members in caring for the baby and dealing with everyday household tasks.
The empowerment of mothers is very, very important because you are investing on them. You need to educate them, you need to empower them, you need to give them skill. They need to be informed, they need to be taught about the KangarooMotherCare so that they are fully empowered and you are sure that there's going to be continuity on discharge. During visiting hour, we meet with the relatives. We are encouraging commitment in that unit, commitment to the well-being of the patients and their relatives, because we need them to support them at home. So that part of health education is for everybody.
This is how mothers and health workers describe KMC support.
It's very rewarding, most probably because the infants grow so rapidly, so you see changes almost on a daily basis.
Last year when I started, I didn't have that much confidence in handling very small babies, but after attending a few seminars and a few workshops on KangarooMotherCare, I've built up my confidence. And I really now enjoy teaching the mothers and actually seeing the carryover on the ward itself.
I think it's a very good thing because really for prematures, they still need that warmth of their mothers. So for being together with their mothers most of the time, it helps them a lot, and then it helps them to grow, to bond.
KangarooMotherCare really does make the baby to grow rapidly, and it protects hypothermia to the babies if it is done properly, and it also helps us, the nurses, because the mother at all times is with the baby.
Kangaroo mother's a good thing about these babies that are coming here. They come with a 1 point something or something, and then after 3 weeks or after 2 weeks, when the mothers put it in the breast, then they get the weight as soon as they can.
I love it. I got my baby together with me.
Because I love my baby, I want to be with my baby all the time. I can't go home without my baby. I am doing KangarooMotherCare because I want my baby to grow strong and to grow fast and to be healthy so that I can go home fast.
Even at home you can do it, so you can sleep with your baby. If you want to take a sleep in the afternoon, your baby is with you.
I'm happy with the kangaroo because my baby, she's growing well.
KangarooMotherCare should be part of the continuum of care for newborn babies. KMC can be practiced intermittently or continuously. Intermittent KMC is usually practiced when the baby is still in the intensive care or high care unit, or where there is no space for the mother to room in and practice continuous care. With intermittent care, the baby is taken from the incubator and placed in the skin-to-skin position for at least 65 to 70 minutes at a time for the most beneficial effect. The preferred method is continuous KMC, where the mother practices continuous skin-to-skin care for 24 hours a day. This usually takes place in a special KMC ward and should start as soon as the baby is stable. It is also continued at home, where fathers and other family members can help the mother. Introducing KangarooMotherCare as a new service requires commitment and perseverance. Healthcare managers are not always keen to make changes. They may think KMC will be expensive. Not all health workers will be enthusiastic about KMC either. They often think it will be more work. This is not the case, as mothers can perform most of the caring tasks. One of the cornerstones for successful KMC is multidisciplinary teamwork. Nurses, midwives, and clinicians need to be convinced of the benefits of KMC and collaborate closely with the allied health professions such as dietitians and nutritionists, occupational, speech language and physiotherapists, social workers, and health promoters. Here are some of the key messages on KangarooMotherCare. KangarooMotherCare should be part of the continuum of care for newborn babies. When continuous KMC is not possible, intermittent KMC should be considered. KMC has benefits for preterm and low birth weight babies, but can also be practiced with full-term newborns. Establishing a KMC service is a multidisciplinary team effort.
When I started implementing KangarooMotherCare in Unit, we started with an intermittent Kangaroo Mother Care. I was just an ordinary professional nurse in a neonatal care unit, and we were nominated to be trained because I had passion about the Kangaroo Mother Care. It's not an individual effort. It needs to be a teamwork. For it to be a success, you need to have a strategic planning. And in your strategic planning, you need to have a vision. Out of the mission and the vision, you get your values. You need to set standards for your unit, and you need to make people aware of this Kangaroo Mother Care, exactly what is being expected from them, so that you gain cooperation.